Thank you, Madam Chair, for affording me the opportunity to speak today. The COVID-19 pandemic has had a substantial impact on the cancer community. Fear of the virus has led to a delay of screening and treatment for tens of thousands of patients. Over the next decade, the National Cancer Institute estimates that there will be an additional 10,000 deaths from breast and colorectal cancer alone due to missed or delayed screenings that could have caught the disease early. Cancer research has also been significantly disrupted by the pandemic. As cancer cases and deaths increase as an indirect consequence of COVID, there will be additional pressure on cancer research community to find new ways to prevent, treat, and cure cancer. Congress must continue to increase funding to the National Cancer Institute to regain the ground that's been lost by the interruption, and in some cases, termination of vital cancer research over the past year, like that being done at Roswell Park Comprehensive Cancer Center in my district in Buffalo, New York. To meet these goals, this subcommittee should commit at least $7.6 billion in overall funding to the National Cancer Institute for fiscal year 2022. This pandemic has thrown existing racial disparities in all aspects of our healthcare system into sharp relief. The situation is no different in cancer care. Although the gap in cancer mortality between Black and white Americans narrowed over the past decade, Black Americans still have the highest death rate and lowest survival rate of any racial or ethnic group in most types of cancer. The delays in screening and treatment caused by COVID-19 will only serve to widen those gaps once again. One area in which these disparities persist is lung cancer. According to the National Cancer Institute, between 2010 and 2015, only 6% of all adults for whom lung cancer screening is recommended underwent this simple procedure. Screening rates vary widely by race. While the screening rates for Black Americans is 6.8%, only 0.7% of eligible Hispanics received screening. And while lung cancer death rates have declined dramatically in the last few decades, it remains the #1 cause of cancer deaths in America. But before a doctor can perform a lung cancer screening CT, their office must have access to a lung cancer screening registry. Currently, there is only one CMS-approved lung cancer screening registry, and that is not acceptable. In order to increase screening rates, CMS should immediately make targeted investments to increase the number of free and low-cost lung cancer screening registries. I urge this committee to prioritize additional funding for registries so that all Americans have access to screening in your appropriation bill this year. I thank you, Madam Chair, and I yield back.
And thanks, gentlemen, and ask if my colleagues have any questions for the Congressman from New York. And with that, let me just say, as someone who is a survivor of cancer and of understanding the need for the research and registries, it's a critically important issue. And I thank you for that. And you can be sure, I think you're requesting language, and we'll speak further to you with regard to resources that you might be interested in. But thank you very, very much for your testimony today. Much appreciated.
Thank you, Madam Chair.